I'd like to thank everyone for your great suggestions in response to my request for ideas for new videos. As I mentioned in the original request, I wanted to choose videos that were not too expansive in scope and which fell within my usual domain of clinical practice. I wish I could cover all of your ideas, and I hope to get to all of them someday, but unfortunately making these videos takes time, and for the near future I can only cover a subset of them. Electrolyte disorders and problems with coagulation, including DIC, were both popular topics that I deal with frequently, so I'll definitely be covering them. I'll probably break down electrolytes into 3 groups, one for potassium-sodium disorders, one for calcium and phosphate disorders, and one for IV fluids. There was also a request for more videos on infections and one for a set of videos on some different class of drugs. So I'll actually combine those together and do 1 to 2 lectures on fungal infections and antifungal medications. I'll be doing a couple of videos on arrhythmias, focusing on mechanisms and EKG diagnosis, and probably a video on antiarrhythmics. I'd also like to do a few on heart failure, as one of the most recent requests has suggested. The suggestions for clinical biochemistry and chest radiography are great, and they are topics I actually was already considering. Unfortunately, they are also big topics, and in order to do them justice, it will take a lot of time. So these won't be the first things I tackle, but will be further down the queue. A couple of otherwise excellent suggestions, which unfortunately I just don't feel qualified covering, include robotic surgery and anesthesia pharmacology. There were some requests regarding echocardiography. Some of my Stanford colleagues have already created an excellent wiki that covers echocardiography for the ICU. If one Googles the terms Stanford and echo, it will likely be the top result. I'll keep all of the other great ideas you've mentioned on my list and will include them as I have time. I also would like to finish the Fluid Mechanics in Medicine series, and I have a small handful of topics that are relevant to needs at my home institution, so I'll be doing those as well. I'm going to start covering your requests in July. To get to everything I've already mentioned, I'll likely be busy for the next 12 months, so if I don't get to your suggestion right away, don't worry, it's probably still coming. So thanks again for all the great ideas, and as always, keep the comments and questions coming.